There we go. There we go. So what times do I need to look out for? I think are you muted? Great, we're gonna give it a few minutes for everyone to join us. We had a lot of RSVPs. Everybody introduce yourself in the chat. I love to hear where everyone's from. I see the Millers there, lots of friendly faces. Les has loaned us Terry, which is wonderful. Terry is our organizer for the discussion series, and she's been doing a spectacular job. I'm so proud of the work that she's doing for us. I love this. I'm seeing a lot of people from our weekly event, our weekly statewide meeting. This is wonderful. Great. All right, it's 8:03, just a few more minutes. What we'll do is we'll start with a little introduction for people that don't know who we are, Indiana for Joe. And then we'll go into our topic for the evening. Dr. Woody Myers will be speaking, so I'm very excited about that. He's a wonderful speaker. And Michelle Studi, am I saying it right? Campbell. Now I'm going to totally mess that up. Is our moderator tonight. So she'll be working and speaking with Dr. Myers about, Terry, the recording is on. Thank you very much. She'll be talking with Dr. Myers about healthcare throughout the state of Indiana. We're really concerned about the quality of the care and access to care in rural areas. It's very important. And then we will wrap it up with some information about Joe's policies and how he will help this, some of those issues in the state of Indiana and kind of what we can do going forward. So, great. Yeah, so make sure you're writing your hellos in the chat there. Hi, Mary Durkin, welcome. This is great. I love seeing all these familiar faces. It's great. So Terry, we'll keep an eye out for Dr. Myers. I think he was going to be a few minutes late. He couldn't come in at the top of the call, so. Great. You can actually start, if there's a particular topic that you want to discuss tonight, feel free to put that in the chat. I'm sure lots of questions will come up as everyone is speaking, and that's where we put our questions too. So also want to make sure that everyone is muted, please. No background interference. We are recording, so. Okay. Okay. All right, we're going to get started. I'm going to flip over to our presentation. Great. Welcome, everyone. This is our first in our series, our discussion series, hosted by Indiana for Joe Biden. Welcome. It's August 7th. And just so you know, we're 88 days from the election, the official election date. Keep in mind that a lot of people can vote earlier than that. So yes, this is a program that we have pulled together. We'll be talking about topics relevant to Indiana and tie them back to Joe's policies. So who we are and what we do. We are a group of grassroots volunteers. We are not hired or the campaign doesn't tell us basically what to do or how to organize ourselves. So that's where that term grassroots comes from. And I am Jenny Okamoto. I'm the grassroots lead for the state of Indiana. I was the former grassroots lead for Indiana for Pete for America when he ran in the primaries, and then I transitioned over to Joe, and we've been going strong for about 4 months now. What we do is we support the campaign. Our goal is to lift up the campaign in the state of Indiana. Campaigns have limited resources. Our goal is to kind of have a structure in place that they can come to us and say, could you help us with these? We interact with the organizers and other staff when it comes to all kinds of things. Our primary focus, though, is volunteering. We're just a core of volunteers available. We can do fundraising. We can make calls on behalf of the campaign, texting campaigns, canvassing. Right now, we call that virtual canvassing, where we do it through the phone and not in person. Get out the vote. That's that infamous GOTV, which is where we're going to help get people reminded to go to the polls and vote. In addition to that, we have a leadership series, which is our training programs. Mary Noon's on the call, and she's kind of our training coordinator leader. And we had a wonderful presentation on disinformation, how to identify it and combat it last month. And we decided to bring that back as an encore. So I'll show you some of the information on that soon. In addition, we have the discussion series. So here we are at Healthcare with Dr. Myers. We have 2 more coming up, so there's 3 in the series. The next one is Bridging the Digital Divide for Education. We've noticed that it's broadband access for a lot of these students is becoming an issue, especially as schools have gone virtual. So we're not just talking about accessing homework assignments now. All of their school and curriculum is online. So we're going to be discussing that. And then the third one that we had planned is racial justice. And we are fortunate that the Indiana Black Legislative Caucus will be joining us. We'll have 2 representatives coming in to speak. Also, what we work on is visibility for the campaign. You might see behind me, we have a big Indiana for Biden sign. We have done 2,500 signs that we have purchased and distributed throughout the state of Indiana. We have banners and lots of fun things. In lieu of those large scale visibility events we would do where, say, Joe was coming to speak and we would help organize for that and promote that, we have kind of created our own grassroots fun times to kind of get these signs out. We also host special events. So we have, for instance, tomorrow, our Indiana Students for Biden is having their first trivia night. So that's going to be a lot of fun. So just keep a lookout, Indiana for Joe Biden, and all of our events are listed on the joebiden.com site. Just so you know, every week, and a lot of you that are here at this meeting already know about this, but we have a statewide volunteer meeting from 6 to 7 Eastern Standard. And we have campaign updates. We have a discussion topics that Terry also manages with speakers from throughout the state. That could include candidates. We've had people from the League of Women Voters. This week coming up, we have Stonewall Democrats and a speaker from the Trinity Haven Shelter. We've had Henry Fernandez spoke on Latinx issues. So we try to have a little mini discussion, a little mini talk every Monday on top of our campaign updates. And then we talk about the volunteer opportunities that are out there and kind of what we're up to in the state. So you can sign up again on the events page at joebiden.com for those. So tomorrow is our first event for students. We're having a virtual trivia night with Dana Black. Personally, I have not met her, but I've heard she's hysterical and we're in for a treat. So the kids actually, they picked her. They're very, very excited to have her. I know she ran for office, but people say you have to hear her speak. She's just really, really incredible. So all are welcome for that. It's a trivia night, but it's more of like a social event to try to, touch base and have fun. We are going to have a prize, which is a nice gift certificate to the Joe Biden store. So I would not want to miss that. So that, once again, you can sign up on that Joe Biden events page. Here's the event, Disinformation, How to Identify and Combat. That's coming up next weekend, the 15th on Saturday. And once again, the 2 upcoming topics. One is Bridging the Digital Divide for Education. And we have Patrick McAllister. He's formerly with, I believe he's with the Mayor's Office on Education. And that will be coming up Wednesday, the 26th. And you sign up at Joe Biden. And then the 2 speakers we're having for our 3rd series is Robin Shackelford and Vanessa Summers, both state representatives. Robin's actually the Indiana Black Legislative Caucus chair. So we're excited to hear from them too. So talking about our Zoom norms, please stay on mute. We are recording, and this helps with any feedback or background noise. So please stay on mute. Be sure to introduce yourself in the chat. We will look at those later. We love to hear where everybody's coming in from. And when you enter a question in the chat, please start with question, because there's a lot of chatter, which is wonderful if people are talking to each other, but this will help Terry and I to pull out those questions that you may
Jenny,
have for Michelle.
Dr. Meyer is in the waiting room. So
oh great. Let me finish up then. Okay. So the meeting will be 1 hour, and I want to thank you for taking the time to join us, especially on a Friday night. Let's see here. So welcome to Dr. Woody Myers and Michelle Studi Campbell. Let me go in there and let our esteemed guests in from the waiting room. There we go. Great. So I'm going to pass it over to Michelle now. Thank you so much, Michelle, for joining us.
Hey everyone, thank you so much for joining us on a lovely Friday evening. We know that you have lots of choices, and we are just so excited that you are going to spend an hour with us tonight learning more about Dr. Woody Myers' plans for healthcare in our great Hoosier state, as well as we're going to talk about what Vice President Biden has in store in a very robust plan addressing healthcare. So as Jenny said, my name is Michelle Studi Campbell. I am a recent graduate of Hoosier Women Forward. I'm a lifelong Hoosier and pretty much a lifelong Democrat too. I turned 18 on election day back in the 90s, and I'm proud to say that I helped elect President Clinton, and my birthday again is on election day this year, and I'm looking forward to celebrating a Dr. Myers win and a President Biden win as well. So lifelong Democrat, excited to be here and so excited to talk healthcare. I come from a family that's been really involved in healthcare. I myself have been in healthcare administration, working at the Ronald McDonald House Charities as the executive director for Indiana, and then running a mental health clinic for youth in Indianapolis. So excited to get all of the questions in the chat, and we've got some questions here to get started, but we are so excited that Dr. Woody Myers is with us. He is, of course, our 2020 candidate for governor of Indiana. He is a third generation Hoosier. He is also a physician, a former state health commissioner, a business owner, husband, father, and grandfather. He wears many, many hats. And as we said, he's an Indianapolis native, and he is a proud product of Indianapolis Public Schools and is a graduate of Shortridge High School. He completed his undergraduate studies at Stanford University and went on to earn his medical degree from Harvard University at age 23. He's like the original Doogie Howser, and a master's of business administration from Stanford University. And so throughout his career, he has been addressing important problems with every organization that he has led, generating real results and leaving each of them stronger and ready for the challenges that lie ahead. Early in his medical career, he worked as an emergency room physician on the front lines. He has also been an educator at the Indiana University School of Medicine. And as a young doctor, he saw firsthand the effect of healthcare coverage and insurance on really the disproportionate effects of care. And so patients with the best healthcare insurance often received the best healthcare, while others did not, and he spent his career fighting to change it, and he'll do that as our next governor. Dr. Meyer, thank you so much for being with us.
Michelle, thank you very much. I appreciate that very kind introduction. However, I'm not sure I've ever been compared to Doogie Howser before. I'm not exactly sure how to interpret that, let's just say.
It's a compliment.
Okay, good.
Oh, yeah.
All right. Well, are you ready to jump in on some questions?
Sure. Well, if that's what you'd like, I'm happy to follow the agenda that you've sent into our team. I see a lot of very friendly and familiar faces on these little boxes on my screen tonight. Instead of calling each one out, I'll just say thank you to all the friends and colleagues that are here on this gorgeous Friday evening. I am pleased to be your nominee for governor in the state. Gubernatorial election this year. Linda Lawson and I are working as hard as we possibly can to win this race. We know it's a winnable race. So again, thank you, Biden team, for joining us, and I'm happy to jump in, Michelle, any way you'd like.
All right, so we'll get warmed up. We had a couple of questions ready, and then we'll go to the chat because I already have questions popping in there. But topic number one, it would be hard to have a healthcare conversation in 2020 without talking about the coronavirus and COVID-19. Certainly the challenge of our lifetime. This virus has impacted every facet of our life here in 2020. As governor, in January of 2021, what would be your first moves to secure a safe future for Hoosiers? What are the lessons we in Indiana have learned or should learn about healthcare in this age of COVID-19?
Well, again, yes, I understand that that has to be very early on the agenda for any discussion, especially ones relating to healthcare. And there are just so many things that we need to do to optimize our response, our fight against the coronavirus and the illness that it causes, COVID-19. Let me just first point out for those that haven't had the opportunity to see their news today, that Indiana today reported the highest number of cases, new cases of coronavirus in the history of the pandemic, period. Since we started keeping records, 1,200 cases, 1,253 cases actually, and that's about 20% more than yesterday, which was then the highest number of cases. So clearly, unambiguously, we are in a major surge with respect to coronavirus in the state. And in addition, a very troubling sign is that our case positive rate of the number of positive cases out of the total has been going up steadily as well. About a month or so ago, it was about 3%. Now it's closer to 10%, 8.5% or so over the last 7 days. So clearly, both moves in the wrong direction. We are now trending towards what we saw in the last month or two in Florida, Texas, Arizona, and Southern California, rather than the trend that one would prefer, which is New York, Connecticut, and Massachusetts. Well, I think everybody will remember a couple months ago, we were all looking at what was going on in New York and worrying about that being the model for the rest of the country. Now it's the envy of the rest of the country. Their positivity rate in the Northeast is in the low single digits, whereas ours is approaching 10%. And that's primarily because we opened up too soon. And we have a lot of young people who just can't stay away from each other and the bars and don't want to wear masks, and on and on and on. And that's really that's what's spurring this on. It's very clear that the pandemic is being spread in Indiana and in most other states by young people, many of whom are asymptomatic, who don't know that they have been exposed, are not aware that they are positive, yet still are perfectly viable carriers of the virus from one human being to another. See, the virus does not know your birthday. The virus does not know what state you're in. All it knows is that it wants to go from human being A to human being B to human being C. And it'll do that in whatever ways it can, primarily by aerial spread. And that's what's got me very worried, this negative trend. So we don't know where we're going to, in answer to your question, Michelle, we don't know where we're going to be in the state of Indiana in January. I really do hope that that we go down and that we are much lower by then, and that we have some room to breathe, literally and figuratively, in the state, and that this crisis, this surge has gone away. But unfortunately, all the signs are pointing against it. In fact, I and many other officials are very worried that the fall is going to bring even more cases as the weather shifts. We know that viral patterns, as they are reported around the world, strongly suggest that a virus like the coronavirus will peak as soon as the weather starts to turn a little bit cool. And that means that the numbers that we see now, we may wish for these good old days down the road of only 1,200 cases a day, which of course would be terrible. We've had almost 3,000 deaths in Indiana. Most of those deaths are occurring in nursing home facilities, and that's one of the mistakes that we've made that I will not make, and that is not concentrating our testing resources where the cases are, the deaths are. The nursing homes in our state deserve far more attention with respect to testing, far more attention with respect to infection control processes, procedures, and prevention, and they're just not getting it from the Holcomb administration. And I just know that in a Myers-Lawson administration, that will change. We will also redouble our testing efforts. We have a contractor, by the way, who is responsible for the vast majority of testing in our state. That contractor, by the way, gave the governor a $50,000 campaign contribution a couple weeks before they got a sole source contract. You know, in the days of investigative reporting, that would have been a front page story. It hasn't really been a big story here in Indiana, and it should have been, but the facts are the facts. And that contractor has also failed to put testing sites where people need them. I was recently in Gary, Indiana, and there are no Optum sites in the third largest city in our state, Gary, Indiana. None, zero. Folks have to go into the southern part of the county and other parts of the state to get the testing that they need from Optum. So all of that's all of those are issues that we will change. And so the first thing that we'll have to do is appoint new leadership to the major state agencies in the state, particularly with respect to COVID. That will mean the new state health commissioner, the new leader of FSSA. Those are two of the key officials that will spend much of their time on the front lines of the state's efforts in fighting this pandemic. And I will, of course, need to spend a great deal of time on it as well as your governor, collaborating with the private sector, making sure that the hospitals, the nursing homes have the PPE that they need, have the supplies that they need, are being able to buy those supplies at as inexpensive a price as we can make sure that they are able to do, and to also make sure that our schools, which unfortunately today are on the front lines as well, have what they need. Schools have a very difficult challenge today with COVID. What to do? Do you open up? Do you close down? What steps do you take? And I've been on at least 3 Zooms today where that's been a primary issue, including with the public school public school coalition here in Indianapolis. And I just know that our educator leaders, our teachers, and our parents are quite worried about the decisions that are being made. So we shut down the Democratic the Democratic National Convention. We shut down the Indy 500. We shut down all major sporting events nationwide, yet we open all the schools. And we believe that the virus knows the difference between a 9-year-old and a 10-year-old, that the virus is going to magically stay confined to the kids and not be transmitted to the teachers, to the custodians, to the bus drivers and others. Yes, I know that in-class learning is the preferred way, to have that teacher standing behind you, encouraging you to get the right answer on the math problem, and to give you that compliment when you get the answer right on the spelling test. I remember those days, as long ago as they were. I do remember them. I know that that's an important aspect of school, but I would rather pause the in-classroom learning for another couple of months and see how this thing moves, and hopefully it moves in the right direction, than to take the risk merely for economic issues. And yes, I know the economic harm that this is providing. We have an unemployment rate in Indiana today that's approximately 14%, and that's underrepresenting what the true economic damage is, because we know that folks that used to have 2 and 3 jobs are now down to 1 and 2 jobs, and they're counted as being employed. And we know that folks that used to get overtime aren't getting that anymore, and folks have had to take salary cuts and on and on. So that number does not represent the misery that of the economic calamity that this state is enduring. So yes, I do realize that. And I also realize the inconvenience to parents who are going to figure out childcare arrangements and so on. But what's more important, public safety, the lives of people that you can't get back, or simply the notion that you got to have school 5 days a week? I'm very much in favor of us pressing the pause button on those districts that are in the clear-cut red zones of our state. I'm okay with some of the very, very rural districts that have had very, very few documented cases, giving flexibility to those superintendents to implement a hybrid model. But for everybody else, I say let's wait, like Washington Township in Indianapolis is doing. let's wait until we've got better data. Let's wait until our positivity rate is in the low single digits. Let's wait until the new cases have gone down for several weeks in a row, and then let's figure out ways to open it up. So that was a long-winded answer, Michelle, to your concise question, but I think those are the key issues that one has to think about today in order to be prepared for January for taking on this most important office in the state.
Yeah, no worries. That is certainly the challenge of our lifetime is COVID-19. I'm the mother to an ingoing up and rising grader. It is something that weighs heavily on all of our minds. And so you took less than 10 minutes on that most critical question, so no worries. So our second question goes to access to mental health prevention and treatment services. According to a recent 2019 Pew Charitable Trust study, Generation Z, which is today's high school students and college students, report the highest level of stress, anxiety, and suicidal ideation that we've ever seen from any generation. This, coupled with the rising demand for alcohol and drug treatment, has put a crippling pressure on our stretched mental health services. How can we expand access to quality care for all Hoosiers, particularly our Hoosier neighbors that are utilizing Medicaid to pay for those services?
Yet another outstanding set of questions. One industry that has not suffered during COVID-19 is the alcohol production, distribution, and sales industry. They're doing pretty well. Beer manufacturers and others are actually having a record sales. And although if you're in that business, that might be good economic news, it's not good news from a healthcare standpoint at all, especially for the young people that are drinking far in excess, and they're doing it because of increased rates of depression. Suicidal ideation is up as well. Domestic violence is up. So mental health and behavioral health issues are now rising as a result of the stresses related to COVID-19, of being literally and figuratively caged up, so to speak, in one's home. And the fact is that we have a dearth of providers of mental health services in the state of Indiana, and that's all the way up and down the chain, from our psychiatrists to our nurse practitioners, psychiatric nurses, to social workers and others, all of whom play a key role in the behavioral health armamentarium of providing behavioral health services in our state. We've got a dearth of practitioners, and I was speaking to a very key provider of services of that nature today, and the waiting list that this provider has is so long that they won't even take new people on the waiting list anymore, because the services are so high, and the calls this provider is getting related to the stresses of COVID-19, everything you could possibly imagine as a indicator of stress are up, and so that is going to unfortunately manifest itself in violence in some cases, domestic violence, especially in suicide, and in depression and inability to go to work, and all forms of mental incapacities and/or maladies related to the inadequate diagnosis and treatment of these services. So what do we do? Well, one thing that we do is we increase the number of providers of these services in the state of Indiana. That's a longer term goal, but we have some fantastic universities. I'm going to quickly assess where they are in their graduation rates of these individuals, and more importantly, what's the retention rate? In my view, it's a little sad that Indiana University is the largest medical school in the nation, yet so many of its graduates leave the great state of Indiana to go elsewhere. Why is that? What are those reasons why we're not attracting and keeping the folks that we admit to our medical school, and what is it that we need to do differently? I imagine that there are economic issues that are a part of it, but no one is doing the studies today that I'm aware of to really truly understand it. We will. The Myers-Lawson administration will understand that issue, and we will do what's required to get our medical school to produce more, our practices in the state to attract and keep more, and to pay appropriate rates for the services that are provided, not just in mental health, but all throughout the Medicaid program. I think as in addition to that, Michelle, we've got to expand the use of telehealth. And telehealth, of course, today is very different than it was a few years ago. Telehealth services are far more widely accepted. People are better at using them and understanding how they can be used, and especially in behavioral health, where the in-person physical examination is not as often required as it is in other kinds of health services. And laboratory tests are not as often required as they are for other health services and disease processes. I just know that we can utilize telehealth services better, and we have to pay, of course, for those services for providers to be able to offer their time to do them. But that also implies that we make sure that we, and this is a related issue, of course, that we get broadband throughout the state of Indiana.
That's a future topic we're having, yes.
Broadband is no longer a luxury. It is a utility, and it should be treated like water and electricity. And so I will work as hard as I can to make the changes in our laws to number one, maximize the offering of a variety of broadband services, especially in our rural areas. But in addition to that, to regulate it in a way that makes sure that everybody in the state gets easy, good access to high quality broadband services that may hopefully include 5G, the services that you see advertised on television all the time. And I have done some investigation of 5G, and yes, it is a better way to provide services. It is you get more throughput. The services are more reliable, but it also requires an upgrading of our infrastructure. I just know that that's going to take a while, so we better get to it. We've got to increase the speed at which we adopt broadband and especially 5G throughout the state. So all of those are related to providing better services in the mental health and behavioral health. And lastly, I think we're going to have to take a careful look at the alcohol taxes in Indiana as well. You know, it's my understanding that we haven't raised alcohol taxes since 1981. A lot of things have happened since 1981. And that makes alcohol less expensive in Indiana than perhaps it is in other states. And that might be a way. I'm not ready to say today that we would absolutely want to do that, but it's certainly worth the study as an opportunity for additional revenue, especially if we provide those dollars for issues related to alcohol consumption, like behavioral health.
Yes, thank you so much. You got a lot of comments in the chat about that broadband piece. So what a differentiator that would make for our great state and everyone in it. All right, so topic number 3 is about rural healthcare. And we've seen so many comments in the chat. So I know you have a lot of people ready for this one. And for this question, you know, for years, economists and social sciences have stated that your zip code truly determines your quality of life. Now that zip code may predict your access to healthcare. As our rural hospitals are struggling to keep their doors open and invest in cutting edge technology that their patients and neighbors need. In looking at the landscape of rural health in Indiana, what can and will a Governor Myers administration do to stabilize and secure rural hospitals and clinics? How would you address the problems of healthcare access in rural Indiana? In many parts of the state, a hospital or even a doctor is more than 40 minutes away.
Well, again, that too is a great question. I've addressed some of those issues already with telehealth. We've got to make sure that we increase the availability of telehealth and broadband to be able to use telehealth appropriately in our rural areas. That will partially alleviate the problem. We also have to produce more doctors and nurses that are able to provide services in our rural areas. That too will partially alleviate the problem. We have to also, in my view, understand the priorities of such services. Let me give you a couple of examples, Michelle. Indiana, has the 3rd worst maternal mortality in America. 3rd worst, behind Louisiana and Georgia. Number 3, in the wrong direction. And so what does that mean? That means we have the 3rd highest number of mothers dying at childbirth and in the first year of life than 47 other states and the District of Columbia. And this is 2020. This is not 1920. we have 33 counties that have no maternity services in those counties, and of our 92. So if you're a pregnant woman in those counties, you have no option if you're going to get maternity care unless you leave the county and go elsewhere. So those are issues that are also solvable. And they disproportionately affect our rural areas. So before COVID hit, I had made it to over 30, I think 36, 37 counties of our 92 counties, many of them rural. And I kept hearing that over and over again. Healthcare access was a key issue that was of concern in those counties. And one of the questions that kept coming up was access to emergency services. It's one thing not to be able to get a primary care appointment. And that's important. But when you're having a stroke, when you're having a heart attack, when you've been in a motor vehicle accident, everything changes, because then speed to access becomes a huge issue. And Indiana has never implemented a plan to create a trauma system in the state of Indiana. And it's right there on the Indiana Department of Health's website. A study was done back in 2012 that said Indiana's trauma system is basically non-existent, and it needs to be fixed. And here it is, what now, 8 years later, and there's been no progress made. I just know that that's a huge issue for our rural areas, especially. Why? Because there's something in emergency medicine called the golden hour. We know that for many patients that are having a heart attack or a stroke, that first hour is so important to treat the shock, treat the injury, to get you stabilized so that the definitive care can occur. And that's, of course, also important in trauma as well. Motor vehicle accidents being one of the major traumas, but also industrial accidents, farm accidents, gunshot wounds, and so on and so forth. All of those issues are vitally important, and so that we need a trauma system that has a designated set of providers who can be responsive to the calls from the local law enforcement, make an assessment, and if trauma care is required, if EMS level 1 services or level 2 services are required, that we can get the patient, the victim, from point A to point B the most efficient way possible without having a lot of intermediate stops that slow things down. So that will be a priority for us as well. I've mentioned a lot of priorities. We're going to be pretty busy, aren't we? But we're going to recruit a very talented group of people who understand these priorities, understand these issues, and are willing to work very, very hard to get it done. So those are just some of the things that we're going to have to do to make sure that our rural areas get the attention they need in healthcare.
Thank you. Thank you. We just are so thankful for your such complete answers. You know, you're not talking in sound bites. You're giving us a real deep look, and just so appreciative of your thoughtfulness and intentionality behind these. And so topic 4, before we go to some of the questions in the chat, was about access and pricing. And I know this is so critically important to so many families as they open those mega hospital bills. It's a surprise billing, and you know, sometimes you really don't have a choice. And when you're sick, you need the care, and then the bills come. So in 2019, the U.S. News and World Report ranking, Indiana was ranked 40th out of 50 in healthcare. The study, released annually, ranks states based on access to care, quality of care, and the public health system. What steps can you as governor make to move us up from 40th closer to first?
Well, on the public health, it's relatively simple. You fund the public health system in Indiana. The infrastructure has been starved now for decades. We are almost at the bottom in the terms of the numbers of the dollars that we spend per capita on public health. That's why so many of our local health departments are so weak. And were unable to do testing early on in COVID-19 because they didn't have the resources to do that. So therefore the legislature and the next health officer, the state health officer, and I, as your next governor, are going to have to reprioritize our public health infrastructure spending to make sure that our local health departments are better supported. Yes, we are not doing well in healthcare. Our grade is D-. I won't give us an F. We do have some fantastic facilities in some parts of the state to which some patients get access, but it really should be everybody. You know, this is 2020. Healthcare is a right. It's not a privilege. And so many of our tax dollars, whether you're in rural Jay County or deep in the heart of Marion County, your tax dollars are going to support the National Institutes of Health, the Centers for Disease Control, the research that's been done to give us incredible new drugs. You know, I remember the days when I was a state health commissioner here in Indiana, and we had a young boy named Ryan White who just wanted to go to school in Kokomo and couldn't do that because the folks up there were too scared and too angry and too unwilling to listen. In those days, things have changed in Kokomo, but in those days, and so when his family moved to another part of the state, we worked hard all summer to get the folks in his new school district to make sure that he was able to go to school. And it was a glorious day, that first day of school, when he was welcomed with open arms. We proved that Indiana could be a leader in HIV/AIDS education. Unfortunately, just a few short years later, Ryan died. He died because he was born just a couple of years and got infected just a couple of years too soon to be able to benefit from the medication that's now made HIV, instead of a lethal disease, a chronic disease. You know, if you follow your doctor's advice today and use the medication that your tax dollars, our tax dollars, help to create, you're able to live with HIV instead of dying from it. And so why are these advances not being made available to everybody? I just don't understand it. I've never understood it. And it's one of the reasons I went into medicine in the first place. And it's one of the key reasons that I am running to be your next governor, because I want to protect the public's health. I want to protect the public safety. I want Indiana to advance. I want us to be a leader, not a follower. And number 40 does not sound like a leader to me. And so I've decided that the state of Indiana, you know, I believe that whenever you're ranked low in the standings, what happens if you're the Indianapolis Colts or you're the Pacers and you're ranked low? Over time, you have to get a new coach. And so I think Indiana needs a new coach. And I've put my name in the hat to run for that job. And I've got, let's see, look at my little clock here, 87 days, 22 hours, 16 minutes, and 33 seconds to make my case, because that's when the polls close. Unfortunately, our polls close at 6 p.m., which is another issue for another time. Why our polls have to close at 6 p.m. is absolutely beyond me. There are very few cows that need to be milked the next morning by Hoosier voters, and like as in the old days. I think the cows are pretty much being taken care of mechanically now. So that's the farm issue is no longer the reason why polls have to close at 6 in Indiana. I just know that if we put our minds together, we can do a much better job and move Indiana's ranking up. And so that's why I'm running to be the next coach of the state in the form of governor, because I believe that our team can perform much better than it's been performing. We need a new playbook. We need new plays. I've told all my friends that I know I'm in the fourth quarter of my career. I've had a great career. I'm a couple touchdowns ahead in life. I got a great family. My family life is great. I just know that I don't want to rest on that 2-touchdown lead. I want to keep running the ball. I want to keep throwing the ball. I want to keep coaching the team until that clock says 0-0-0. And I hope that clock is going to be ticking away for quite some time. But until then, I want to give it the best shot I can and make Indiana the state that I know it can be.
All right. Well, Jenny, I know you've been going through the chat. Do we have some additional questions for Dr. Myers?
Yeah, they're just a little bit expansion on all the wonderful information that Dr. Myers gave us is fantastic. You know, staying in vein, we'll work backwards when we talk about rural health care. How do you think the state can play a role to compel people to keep the hospitals open? I mean, a lot of these are for-profit institutions. They're losing money. They're shutting. How do you feel like as governor that, you know, we can, you know, support rural hospitals to keep them open?
Some are for-profit. Many of them are not. I mean, there's a mixture out there. One of the phenomena that's occurred in recent decades has been the growth of mega healthcare systems, and that's because it's more efficient from a business standpoint to operate a healthcare system than an independent hospital. Because that means, for instance, when you have a healthcare system that has, let's say, a dozen hospitals in it, you could have one central location where you do HR, one central location where you do billing, and on and on. That means that it's less expensive per transaction to do it that way. Whereas if you're an independent facility, you got to have all of that infrastructure and you got to manage it yourself. And that's just in this era that we're in today, that's not as easy to do as it used to be. And the challenges are just they're surreal. So you need help. And so I think that what we've got to do is let me back up. In medicine, here's what happens. When you go to see your doctor, the first thing your doctor ought to be doing is a history, figuring out what you think is going on, asking you questions to understand the history of the present illness. The next thing your doctor does is a physical examination. Listen to your heart, to your lungs, look in your eyes, your mouth, and so on and so forth to understand what signs are present that indicate health or disease. The next thing, laboratory tests, scans, x-rays, etc. All of that's to see what we can learn through technology about what's going on. And then you create a problem list with the list of potential issues, and that's called your diagnosis list. And then you decide what treatment or what next steps are appropriate. That's the method that we utilize in medicine to determine how to take care of a patient. So I don't want to tell you that the diagnosis of what's going on in each rural system or each rural hospital is the same. It's not. But there are some common themes that we ought to recognize, one of which is the business costs are far higher today than they've ever been. The efficiency is less as an independent institution. What are the ways the state can augment that efficiency for the rural hospitals that are not-for-profit, that are left, in order such that they can continue to survive? The next question, of course, is are they properly sized? If you have two rural hospitals that are a few miles apart, and then no rural hospital from 50 miles around each of those, should those two rural hospitals come together in some way to create one successful center as opposed to two unsuccessful centers? Those are the kinds of questions that you're going to have to do a detailed look at in order to make an assessment. So I know that there are some talented folks in many of our universities who are able to study these issues relatively quickly to give us the answers that we need. So we need to do a diagnostic examination of the rural hospitals that are out there and determine, of those that are still in place, what are the common diagnoses of what's going wrong? And therefore, what are the steps that the state ought to take in order to support them, in order to make sure that the communities get what they need? Because that's the real issue. The issue is not necessarily the survival of every single rural hospital. The issue is what is necessary for the best outcomes for the patients that live in our rural areas. That's what you have to determine, and we'll do the right kind of assessment to make that determination. But there, I'm sure, are going to be some common themes: infrastructure, cost, and ability to get that infrastructure or get those common services done in an efficient way. It will absolutely become one of the issues. And I think we're also going to have to engage the help of some of the larger systems. What are the ways that the larger systems can help without completely obliterating the rural identity of those facilities? You got a small town that's very proud of its facility. You get these gigantic systems coming in, and they want to take it over. They want to get rid of the team that's there sometimes, and they want to put their name and logo on the facility. I think there's some intermediate strategies that our friends in those big mega systems can use in order to preserve the rural character and identity, to make sure that the community continues to feel served by that facility, but at the same time, give them the helping hand that they need in order to continue to move forward.
Awesome. I think most of the questions actually were answered thoroughly, very well.
Yes.
Just one comment from Marcia, which was interesting. She said, perhaps a bill for improving rural health care can be named for Governor Bowen, a rural doctor from Bremen. It would be an attempt to reach out to Republicans. We need
Not only that, Doc Bowen was a great guy. I'm proud to call Doc Bowen a friend. I'll tell a very quick story, Michelle. I know you got other things
Please.
you want to cover tonight,
No.
but I was a state health commissioner under Governor Orr, who was lieutenant governor to Doc Bowen. And then when Doc Bowen left the governor's office, he was appointed to become the Secretary of Health and Human Services under George Bush. Under Ronald Reagan. And so I am appointed because of all of the things that were going on in HIV/AIDS in Indiana. I'm appointed to President Reagan's first HIV/AIDS commission. And I know there are very few people on this Zoom that even remember that. And I was the vice chair of that commission. Very, very short, I'll tell this very quickly. The chief of staff for Reagan was Senator Howard Baker from Tennessee. And the chairman of the commission was the Gene Mayberry, who was the CEO of the Mayo Clinic. And the right wing people were just using this HIV/AIDS commission to get all these crazy theories. Homosexuality is the wrath of God, and we need to be concerned about it. And that's why the epidemic is spreading, and we've got to do, I mean, all of this. And Gene Mayberry and I looked at each other and said, there is no way we're going to be able to give that kind of forum to these kind of folks. And so, long story short, Howard Baker said, well, yes, you are. And Gene Mayberry and I said, no, we're not. And so Gene Mayberry called me one morning and said, Woody, I got to let you know, man, I turned in my resignation today. I just wanted to give you a heads up. And then Woodrow Myers, not being a complete dummy, said, if the chairman is resigning today, I better do something like right now. And I called Secretary of Health and Human Services, Bowen, and got his great advice, and he knew exactly what was going on. And let us just say, had I not done that, I do not believe I would have been state health commissioner a whole lot longer, because Doc Bowen was able to do some things that I might put them in my book one day, but Dr. Bowen was able to do some things that allowed me to keep my job as your state health commissioner back in the 80s, because he was that kind of guy. And I remember visiting him in Bremen before he died. We talked for a long time. His wife made us tea. We told stories. We talked about various legislators and what they were doing and why they were doing it. It was a great conversation. I truly appreciated him as a leader. And yes, we were at different parties, but you can be in different parties and get along with each other. We can disagree without being disagreeable, and we can collaborate. And that's the last thing I'll say. I know you've got to move on. As your next governor, I know that it'll be required of me to collaborate with all members of the legislature, irrespective of party, rural, urban, black, white, male. None of those things are going to be issues. What's the issue is, how do we help Hoosiers? What do we need to do to move the state forward? And what good ideas do you bring to the table that we can merge with the good ideas someone else is bringing to the table, so that we can get this job done? And that's the skill that I hope I've developed over the years, and that I'll need to bring that A game to this job in January after the election. So thank you very much, Michelle, for this opportunity this evening. And thank you, Jenny, for the great questions.
Wonderful. Thank you so much, Dr. Myers. Thanks for joining us.
Thank you, guys.
Yeah.
Appreciate it.
Thank you.
Take care.
We'll be with you for the next
Go Joe Biden.
Yeah.
We've got to get Joe Biden in the White House. A lot of Indiana's problems are going to get much better having President Joe Biden in the White House, helping the great state of Indiana move forward. That's what we've got to get done. So you got to do your, I want your help too, but Joe and I have to be able to work together. And I know that the guy that's there now, he's not going to be the right one to partner with going forward. So thank you for what you're doing to get Joe elected. Appreciate it.
Thank you. And I put Woody's, Les is holding up one of your face masks. I put Woody's web address in there if you want to learn more about the Myers-Lawson campaign. And I also posted some information about the web address for Hoosier Women Forward, which is a great organization for future women leaders in politics in the state. So thank you so much.
Absolutely. Thank you guys very much.
A little bit more about Joe. So thanks, Woody.
Take care.
So Michelle, would you like me to go over to the slides?
Yes.
And we can just talk. So let's do a screen share and I'll pull that up for you.
All right, everybody. I know that that conversation took quite a bit of our, but boy, wasn't it worth it? Just such full answers that
Yes.
I tell you, there's not another politician that would spend that time and go in that depth. And so, so excited to see him as our next governor. And so on your screen right now, you see the direct web address to get to Vice President Biden's healthcare plan. And it is truly a robust plan. And you can tell through that plan, they've really thought about everything from access, rural healthcare, the disproportionate hit of healthcare to minorities, and have a lot of answers on that. So knowing that we only have a few minutes left, I'm going to talk about those 4 pillars that the Vice President and his team have put together, and certainly encourage all of you to go to that website, continue reading and drilling down on these issues so you'll know what Vice President has in plan when he assumes office in January. So first and foremost is give every American access to affordable health insurance. You know, the Obama-Biden team went a long way in doing that earlier, and that plan needs revived. And so part of that first pillar on access to affordable health insurance is giving Americans a new choice, a public health insurance option like Medicare, but it wouldn't be a requirement. Increasing the value of tax credits to lower premiums and extend coverage to more working Americans. And in that plan, they talk about people making about 100 to 400% over median income to be able to afford that tax credit or take advantage of it. And then expanding coverage to low-income Americans. You know, so much of the Affordable Health Care Act has been rolled back, and this will be an attempt to really make that whole again and improve on the lessons learned during its first reiteration. So the second pillar is provide the peace of mind of affordable quality healthcare in a less complex healthcare system. So I think all of us here tonight, certainly either ourselves or someone we know and love, has had to have an unexpected healthcare visit. And you get great care, perhaps you've been to a couple different hospitals, and then about 6 weeks later, the bills start rolling in, and you have to have an accounting degree and a medical billing degree to figure it out. And so through this, all Americans will have a new, more affordable option. Middle-class families will get a premium tax credit to help them pay for coverage. Lower cost and improved health outcomes by partnering with the healthcare workforce. And that's a lot of great information when they drill down and give the specifics on that. But it's actually expanding frontline healthcare workers and really more of a prevention model as well as that urgent care piece. Tackling market concentration across our healthcare system. And we just heard Dr. Myers talk about some of the large mega hospital complexes that have 20, 30, 40 outlets in a state, almost like a monopoly. And then again, stopping the surprise billing. In no way should it take $30,000 to have a baby in this country. And that's really for like an easy breezy stay. So really when you get into long-term care, it's just the surprise bills are really, it's like playing with monopoly money, and we need to right size that and put a little more intelligence behind that billing. So the next pillar, please. So the third pillar is stand up to abuse of power by prescription drug corporations. So that's always a tricky one here in the state of Indiana, where we have, of course, some giant pharmaceutical companies, but repealing the outrageous exception, allowing drug corporations to avoid negotiating with Medicare over drug prices, limiting launch prices for drugs that face no competition and are being abusively priced by manufacturers, limiting price increases for all brand, biotech, and abusively priced generic drugs to inflation. And I think we've all heard about insulin is one of those drugs, the EpiPens, that price gouging through the roof for really critically important drugs. Allowing consumers to buy prescription drugs for other countries. You know, There's also a lot of cases where the drugs that we pay $300-400 a month for a supply are pennies on the dollars in other countries. And so that would open up greater competition in the pricing market. Terminating pharmaceutical corporations' tax breaks for advertising. And then Jenny just moved me to the fourth one. So
Sorry. Oh, was perfect
that's
timing.
okay. Now we're back. No, we're good.
Okay, I went back.
Right. I'm getting dizzy. All right, it's 9:01. And then improving the supply of quality generics, which is so critically important for folks who have to make that decision right now about food or their health or their medicine. And that should not have to be a choice that anyone has to make. All right, pillar 4, it's 9:01, we're cruising home. All right, ensure healthcare is a right for all and not a privilege for just a few. Expanding access to contraception and protect the constitutional right to an abortion. Reducing our unacceptably high maternal mortality rate, which especially impacts people of color. And again, you heard Dr. Meyer say that we are the 3rd worst when it comes to maternal mortality. Defending healthcare protections for all, regardless of gender, gender identity, or sexual orientation. Doubling America's investment in community health centers, which would be huge for our state. And achieving mental health parity and expanding access to mental health care, critically important. I worked for a mental health organization that had counseling for inner city youth, working with our public school system and our juvenile justice area. When my students even attempted suicide and we wanted to get a hospital admit, it would take weeks to get a student in. Weeks after they'd already attempted suicide. So achieving that parity and access to mental health care is critically important for all Hoosiers. And so that is the 4 pillars. I think Jenny has a wrap-up slide, and thank you all so much for spending your hour and extra few minutes with us this evening.
Michelle, you are amazing. What a great job. Our first discussion series, and I'm so proud of it. Just great job, everybody. I just have a few things to wrap up, just talking about going forward. Make sure you join us for our next discussion series. Once again, you just go to joebiden.com and you can sign up there. Be sure to donate, whether it's to Woody Meyer's campaign or a local down ballot or Joe Biden himself. We would appreciate it. Those campaign ads cost a lot of money, and somebody was noting that they've been seeing multiple ads for Holcomb. Well, media buys are just budget. They just kill the budget. So anything you can help.
They're like prescription drugs. They're expensive.
Yeah. Please, we can help you host virtual events. We could even help you host a virtual fundraiser. And so reach out to me if you're interested in that. Make sure you're signing up for activities and volunteering with local candidates, Dr. Myers himself or Joe Biden. And support candidates on social media, like their posts, repost, share. That's a low level of interaction that you can do very easily. And just, by sharing and liking positive posts that you see, and talk to everyone you know in the state about voting, because it's all going to come out to turnout in the state of Indiana. And we are making such great progress that we want to have those people show up at the polls. So thank you again for everything. And we'll see you next time for our next series. Great. Any last minute questions? I know we're over the time. So yeah, I think we're good. Oh, I see Annette posted in there, Christina Hale's website, Hale for Congress. Can't forget that. We've got such talent in our down ballots. It's amazing what's going on in our areas with young leaders, women leaders specifically. So impressed. So thank you. So thanks everyone for joining us, and we'll see you at our next discussion series. Bye.
Thanks, everyone. Have a great weekend.
Hope to see you Monday for
Go
our
Democrats.
volunteer event. So thank you. Thanks again, Michelle. Great job. Wonderful.
Looking forward to the next one. Thanks, everyone.
Yep. Thanks, Terry. Thanks again for joining us and taking the time, everyone. Bye, Mary. Bye, Jackie.